We sit on the cusp of a very interesting point in history where probably healthcare in this country is going to move in a radically different direction over the next 10 to 20 years. That is to say, you know, in my career, things are going to change very radically from the way they are now.
But Benjamin Rush Institute is unique in that we are really focusing on healthcare professionals, and a lot of that right now are the medical students. We really bring in a diversity in the points of view to the medical school campus and their healthcare policy discussions.
They're very open. They're out there to educate all physicians, all medical students on both sides. And I think they are starting a conversation that's very much needed, and I think that's their biggest role.
We have the solutions. We can create the innovation. We can actually improve access to care using the free market. And so there's nobody else doing that. There's nobody else bringing that side of the conversation.
No physician can escape what's happening in our political system right now. The number of regulations and new laws that are being passed that directly affect their ability to decide what's best in their patient's best interest. By having people involved in Benjamin Rush, they're going to understand those issues much better. They're going to be able to advocate for themselves and for their patients in a way that is profoundly more educated and with a deeper understanding.
I've just been getting so much information that I never would have been exposed to before, which has helped me then to form arguments. So when I debate with other students about how we should have our healthcare system set up, I now know what to say. And I have facts, and I have statistics, and I have solutions that people have brought to my attention.
The free market perspectives are not really represented and not really discussed currently on medical school campuses, and that's something that Benjamin Rush Institute can provide.
These students are entering this world, and they are facile with all the digital abilities. They have that creativity to put that knowledge and experience into effect. They're partners with their patients. They're partners with the other healthcare professionals that they're working with. They get the importance of autonomy and really empowering their patients.
Joining BRI and seeing really how many people feel the same way I do has been very empowering, because I know that there's strength in numbers, and if we come together and share our ideas, share our stories, and work together to educate other people, we really can make a difference.
The reason to get involved at Benjamin Rush is to not only learn more about policy, but to learn more about why you have to be an active participant in the policy-making process, as well as the advocacy arena for the profession and for your patients, because if we don't do it, who else is going to?